Good afternoon, Jessica. Thank you
Hey,
very much for taking the time to come in and talk to us today about your experience at Downtown Dental.
thanks for having me. It's a pleasure to be here.
Well, we really appreciate it. First question I'm going to ask is kind of tell us what you thought has been unique about your experience at Downtown Dental relative to all of your other dental experiences.
My dental history has been very storied. I started having work done when I was like 6 or something, and not just the normal cleanings or things like that. It was like go and get all your molars extracted or something. So it
A
was
lot more than you bargained for.
yeah. It started early. So my relationships with dentists started in a very like traumatic place because I was a kid and kind of didn't really want to
Yeah.
deal with it.
And that can be challenging later in life for many
Yeah,
of it.
yeah. When it's built up, and every time you go, there is a problem, and somebody finds something, and you're having to do all these painful things, and it kind of gets a little scary when you have a choice. Um, when you are trying to decide whether or not to keep up with those regular appointments because of the fear
Yeah.
that you're going to find something, or even the elective things that would are maybe not necessary, but the best thing to do,
Sure.
if that makes sense. But the unique situation came when I met Lisa, who's here, who was patient enough to walk me through understanding the role of dentistry in my whole health, picture and whole health care and self care. And so being able to have kind of partners as opposed to seemingly that whole hierarchical dentist to patient relationship, it's let's partner with you to ensure that like your dental health is contributing to your entire health,
Yeah.
and understand the other way around how your lack of dental health um, inhibits your entire health has been vital, kind of in assisting me in my healthcare journey altogether. So that's been unique to be able to have a place to go where you can trust the answers to your questions,
Yeah.
a place to go where you feel like if there is a fear or a skepticism about something you've been told in the past, it could be reassured. Um, you can be reassured that the decision to move forward is based in fact and data, and those cool pictures that you guys do,
Yeah.
and just to have sound healthcare advice. Um, I've never been here and had a procedure done that I felt like I didn't understand why it was happening. I've never experienced a situation where I was unsure of should I have gotten that tooth pulled, or I know I've had a couple of situations where I needed root canals, and I've even had a implant or two. So sounds like I've had a horrible mouth, but
Well, it's really good for me to hear this because one of the things that we talk about all the time is we want to give you the education and the knowledge and give it to you in a way that you can understand it. And then our next responsibility is to support you in whatever you decide to do. And to hear you say that you've had to come in and you've had to have some very complicated things done, but you went into those procedures with comfort and confidence in what was happening, that's huge for us. I mean, I mean, we can do the dentistry all day, but that's kind of our biggest responsibility is to make sure that you guys as patients have that moving into a procedure if it needs to be done. It
and
makes me really
I've
happy to hear
felt
that.
that. I've felt that. I mean, you're always a straight shooter. I never feel like you're trying to pull the wool over my eyes, or it's everybody on the staff. It's I feel confident that that which I can see and that which I can't see is being taken care of.
That's
And
great.
anyway, and there has also been instances, I don't know if you remember that, where you're like, well, this wasn't quite done the way I wanted it to be done, so you did it over. And so to have that level of surety and confidence it's vital. It's important for patients to be able to feel that they can trust the information. And then you can, like, you guys are so informative that even if you go and Google it, like, you equip us with enough information to open the journey so we can find out more for ourselves.
Yeah,
So
that's
if you're
great.
not, yeah, so if you're
That's
not
great to
confident
hear.
in what, and if I wasn't confident in my knowledge of it, you gave us enough information that we can, that I could go and explore further.
You're going
and
to build off that
figure out.
foundation.
Yeah, and if I have further questions, just call you, call the office and ask more. It's been a very cool experience to feel like a partner.
I'm happy to hear it. Most people don't describe dentistry that way. At least the patient end of it.
Yeah, no, believe me, this has been a unique experience for me because I really wouldn't. I don't like dentists, honestly. But I like
I get
you.
it. I get it. I get it.
Yeah,
I have a different affectation in the walls of the office than I do outside of it.
That's right. No, it's just the sound and all the wonderful tools that you guys use to kind of help ease the patient. Sure. The offices are comfortable. Everybody's friendly. Nobody's, it's just a different feel. It's very comfortable.
It's always nice for me to hear these things because usually during the day I'm like popping into a room and blah 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 and pop out, and I don't always get to have these conversations with people, so it makes me feel good to hear this stuff.
Well, it's true. It's really true. It's not, I'm not trying to butter you up or anything. I wouldn't come if I didn't feel comfortable.
I had a whole list of other questions I was going to ask, but I think you just answered all of them when you got started talking. So.
Well, good. Thank you. Thank you for everything. Like, my dental journey has been so much more productive. Mm-hmm. I've had several cleanings now where we haven't found things, and if there were issues, I could actually notice that there is an issue, right? Mm-hmm. So sometimes when your baseline is so low, you don't realize that there is an issue until you come in.
Yeah, that's right.
But now that I'm back to a healthy state, when there is an issue, I can understand that there is an issue, and I can come to you.
You can feel it. And intuitively, you can tell something's going on.
Right, yeah. So having you guys guide me to my normal has helped me to understand when there's something acute that needs to be addressed, mm-hmm. and we can go in, and I feel confident that I have great partners that I can depend on in order to address anything.
I love it.
That happens. So thank you.
Well, thank you very much for taking the time to come talk to us today, Jessica. We really appreciate it.
No worries, anytime.